So good morning, ladies and gentlemen, and you're very welcome to the beginning of Wednesday's session on This is Liffey Hall 2 on antimicrobial resistance. So my name is Frank O'Sullivan, I'm your chair for today, and first of all, I'd just like to mention a little bit of housekeeping issues. You're aware of where the exit doors are in case of emergency, and also in respect for the speakers, can you please turn your phones off or to silent if that's okay. So first of all, can I introduce and welcome Theo Lam. Theo is from the Netherlands, from GD and Utrecht University, and he's going to present a paper on R.E.S.E.T, the mindset on antibiotic usage in dairy cows. So you're very welcome, Theo.
Thank you. Good morning, everybody. I'm happy to see that there are so many people here this morning, whereas there are many interesting conferences or many interesting presentations right now, also in other rooms. Thank you for that. What I'll talk about with you is the mindset on antibiotic usage, specifically on what we did in dairy cows in the Netherlands. The title is R.E.S.E.T, the mindset, and that's one part of the presentation that I'm going to give. Mindset things, how attitude, how people think about antibiotic usage, and the antibiotic usage, that's the other part. Some of you might have seen this graph. This is what we did over the past, say, 10 years in the Netherlands with antibiotic usage, and it has decreased enormously. What I'm going to talk about this morning is what I think, what I and my co-authors think is the approach that has been led to, or that has led to this successful decrease in antibiotic usage. So you'll see this graph back at this histogram back at the end of my presentation. Reset the mindset thing, the attitude thing. I had the opportunity to learn about it when I was the project leader of the Dutch Oral Health Center, in which we started with a technical approach, and that's what my background is, mastitis. I'm a mastitis man, with a technical approach of improving udder health, which has all these 5 points that you know on infectious pressure, host resistance, feeding, milking machines, treating, control, so monitoring, all these aspects. But at some point, we learned that to reach our goal within our country, to actually improve udder health, we needed to do more than only the technical approach. I worked with Jolanda Jansen, whom some of you might know, on mindset things, on how to reach farmers, on the different types of people to approach them, on different communicative approaches. This type of farmer, the internally motivated one, you approach them through a central approach based on reasoned opinions. These are people that are motivated and they're nice to work with. Using that kind of arguments on technical things, that's most effective because these people really want to improve in that situation udder health. But that's not all the farmers. You also have these ones, the non so much motivated ones that have other things on their mind. And to change their behavior, if that's your goal, and it was our goal in udder health, you need other approaches. You need what we call the peripheral approach. You have an external motivation, indirectly. Not on the subject itself, because that's not their primary interest, but other approaches. So rational argumentation doesn't work there. There basically are 3 ways to motivate people. I'll go over that quickly. Penalize the unwilling, you have the stick. You inform the unknowing, you have to preach, and the third one is that you're inspired or willing, the already internally motivated people, by using the carrot. So the stick, the preach, and the carrot. The health belief model from some 25 years ago of Janssen and Becker was a great help for us to realize how we could actually change behavior. And the first thing for people to change behavior is that they see a problem. And you must have the feeling that they're susceptible to the problem, and that it's some kind of severe, that it does hurt. So they have to believe there's a threat. And the second thing that's needed is that they see a solution. That's this part. So are the proposed measures or the preventive measures, are they effective? Are they doable, and are they successful? And if those two things are there, if there is a threat, and if you see a solution, then behavior may change. The health belief model, that's called. So all this knowledge that we had through this, this other health project, we thought it worthwhile to make a book of it. I did that together with Jolanda Janssen, and his name is Roland Wessels. He's a companion animal practitioner from the east of our country. And we wrote this book that has been translated also in English, as you see, and in Spanish. One part of that book is the R.E.S.E.T mindset model. That model is based on communicative scientists from Woerkom and Kees Leeuwis, what is it, 10, 15 years ago. And we transferred that model into the R.E.S.E.T model. And that's what I'm trying to show you this morning. The R.E.S.E.T model is about changing behavior, is about the cockpit of the mindset, where you have different buttons to push on. Rules and regulations is the R, the E is of education and information, the S is of social pressure, the second E is of economic incentives, and the T is of tools. And each of those buttons you can use to change behavior of an individual person. When you try to change the behavior of a whole group or of a whole nation, like we try to do in other health, and as we also wanted to do in antibiotic usage, you don't have to use either of them, you have to use all of them. So it's not or rules or education or this or that. You have to do all of them in order to actually change the behavior of large groups. So behavioral change, the R.E.S.E.T model. Here you see the 5 buttons again. How does it work? What's the model of Van Woerkom and Leeuwis? The first one is the external motivation. That's the rules and the regulation, as you see here. They force people to change their behavior, like in car speeding or in other things. And they're powerful, but only as long as they exist. When they're gone and people fall back to their old behavior. As I said already, the strongest one, the most effective, is in internally motivated people. If you give them information, they will be convinced and they will change their behavior for a reason. The other part of external motivation is where you don't have rules, where you don't have regulations, but there still are possibilities to use them, to indirectly change behavior of people that are not internally motivated. That can be through social pressure, norms and values, economic impulses, and also on tools. And what you do then is that you change the circumstances that actually change external motivation. I'll give you an example. Don't drink and drive. When I was young, when I was a teenager, drinking and driving was a normal thing to do in our part of the world. People did that. Maybe not so good, but some did that. That changed. We have alcohol locks. There was a lot of campaigns on drinking and driving, on regulations, spend your time in jail if you like, choose to ride. And there were all kind of media campaigns and also rules and regulations and also tools to change that. And that actually changed. And if you put that into the R.E.S.E.T model, you'll see that there are all kind of controls. You saw the graphs on the jails. There is all kind of education programs. The social pressure is enormous. And I'm convinced that even if there would not be any regulations and rules anymore, the mindset about drinking and driving has changed nowadays. You don't do that anymore. Boozers are losers. That's what we think, because all the things that I showed you in the previous slide. So that is about rules and regulation, but it's also about other things, to actually change behavior of the population at large. And of course, that's far more complicated than the R.E.S.E.T model, so there are all kind of interconnections between them, but that's only to make it a bit of understandable. Okay, back to antibiotic use, based on this model. You know this story, the overuse of antibiotics. A lot of people here in this room this morning. We have an overuse of antibiotics in the animal industry. Humans are exposed to antimicrobial resistant pathogens. We had our incidents on MRSA, on ESBLs, and we'll talk about that this morning. So there is something to do there. In the Netherlands, in the dairy industry, but in the animal industry in general, antibiotic use came into the spotlights. There were political discussions on it, and we had to decrease or antibiotic usage by initially 20%, then 50%, then 70%, because politics decided so. And it didn't matter what we thought as scientists or what the people in the animal husbandry thought, it just had to decrease. It had to be done. And me working in the dairy industry, working with cattle, there were a lot of people that thought that we didn't have a problem. We were, compared to the hogs, compared to poultry, compared to field calves, we were low antibiotic users, and we didn't have a big antimicrobial resistance problem. What you see here is chickens, pigs, field calves, and dairy cows. That was in 2009 when the whole thing started in our country. And this is E. coli that were isolated from, it's just an example that were isolated from the environment of the animals. And you see that the percentage of antimicrobial resistance was much lower in the dairy industry than in others. But at the same time, our community thought that something had to change in the animal or in the dairy industry. We are part of the animal industry. And this is some kind of advertisement that was in our national newspapers like a couple of months ago from an NGO which is called Waking Up Animals, something like that, Wakker Dier, or Woken Up Animals. And this shows the evolution of the dairy cow. And that's how they think about the dairy industry. And that is a heifer, and I don't know exactly what that is. That doesn't matter. But that's how people look at the dairy industry, and that means that we have, as a dairy industry, have to do something with that. So something had to change into dairy and dairy people working with antibiotics too. And we did a couple of things, and I just picked out a few things, 3 of them. We had to make antibiotic use transparent, as the other industry branches, the field calves and the pigs and the poultry also. We had to make it transparent, and we introduced a number, the annual defined daily dosage. I'll talk about it. We had to limit the use of critical important antibiotics, and another thing that was important for us is that we were not longer allowed to use preventive dry cow therapy, blanket dry cow therapy. So the first one, making antibiotic use transparent. There was an independent committee, the Veterinary Drug Authority, that monitors and judges our national trends. They set benchmark, they identify problem areas, they say what's good and what's bad. That's an independent expert panel with all kind of organizations. It's not what the dairy industry itself did, it's an independent panel, which is important to convince our politicians. An important thing that they did was that they said that animal defined daily dose. Basically, that's the average number of days that an animal is treated. And our farmers nowadays, and I'll show you that in a minute, call it the antibiotic number. That's how they call it, and they know what it is. So it had to be introduced, and people had to get to know it. Second point, critically important antibiotics, and here I listed them. I'm not going into detail on them. The third and fourth generation cephalosporins, you know it, fluoroquinolones, long-acting macrolides, and polymyxin B and E, cholestyne. And these antibiotics, they are the cause of some of the problems that we have in dairy cattle, that we have in cattle. There have been some publications on that, PVM on the use of these third and fourth generation cephalosporins as related to ESBLs. We are working on it ourselves in our groups. I'm not going into detail on that this morning, but there is reason not to use them, not only from the preventive part, which is reason enough, but also from the problems that we see in dairy cattle. So we use them a lot. We use those critical important antibiotics a lot, but nowadays we are only allowed to use them when there's no other choice, when you don't have an alternative, and when you show there is sensitivity to that. So there's no sensitivity to first or second preference antibiotics. You have to use those critically important antibiotics. And this is what happened. The animal-defined daily dosage until 2011 was high, about 0.6 until 1, and then suddenly it decreased to a very, very limited use. And that was, you could say, based on these rules. It was no longer allowed anymore, but it was also based on our attitude, on our approach. Until 2011, we said it was good to use these products because you have zero withdrawal. And that's good because you don't have residues. And that's a valid argument. But after that, we introduced also the thinking about the resistance, potential resistance problems that developed. So the being smart, getting smart about preventive antibiotic resistance. And our farmers told us that they just didn't know, or practitioners, me, myself included, never talked about that subject. We talked about residues and not about resistance. So yes, it's part of the rules, but it's also changing of mindset. Third point, blanket dry cow therapy. In the Dutch Other Health Center, the big project that I told you about, we promoted blanket dry cow therapy. And in 2008, we did a study. Otle Sampimon, who's here among the audience, did that study. And we found that 87% of our herds used blanket dry cow therapy. And we were somewhat disappointed. We had hoped it to be more. And then about a year later, the same person, me, had to stand up and say, okay, folks, today the color is blanket. Not anymore. We go to selective dry cow therapy. And we had to explain that. Why was that? Where did the science come from? And we did all these stories, and we went around and we told it to the people. And well, I'll show you what happens. We did our research. This handsome guy, Christian Scherpenzeel, you might have heard him presenting during this conference earlier. He's doing his PhD on selective dry cow therapy. And basically he found that, yes, if we go to selective dry cow therapy, there is an increase in clinical and in subclinical mastitis. And yes, there is an effect at the herd level, but that effect is limited. And the selective criteria that you use on which cows to treat with antibiotics at drying off, they do have an effect, but that effect is not very huge. As long as you introduce selective dry cow therapy, that does have an effect, and it really has a significant effect on antibiotic use. And what he's currently working on together with Henk Hogeveen is that we're doing an analysis on the economic effects. And what will come out, we don't know, we're working on the publication of that, is that in low bulk myxomatic cell count herds, blanket dry cow therapy is not the economic optimum. So if your udder health is good enough, it's economically attractive to have selective dry cow therapy, which also is one of the arguments to change that behavior. So what happened in real life? We did this research, but politics didn't wait for it. They said, you go to selective dry cow therapy now, which was 2013. Whereas the Royal Veterinary Association, he was working on how are we going to do that? What will be a guideline to do that? How do farmers and how do vets have to do that? Weren't ready yet. We were working hard on it. They were working hard on it. But the guideline to do that only was launched in 2014. Whereas we were interested in 2013, what was happening? How did farmers pick that up? Where they had to do selective dry cow therapy, but nobody told them how. So we were interested in the uptake, in the effect on udder health, which were the risk factors, and what did people think about it? What did practitioners as well as farmers think about it? In short, the results of that, selective dry cow therapy was implemented quickly. 70.5% of farmers did that in 2013. Antibiotic use for dry cow therapy decreased with 28% in the first year. On a national level, subclinical mastitis and bulk myxomatic cell count did not significantly differ between 2014 and 2013. Inge Sandman, Berends published just a paper on that. And yes, there are management factors that do influence the effect of going to selective dry cow therapy, and they are not surprising, they are not very surprising risk factors. They are things on infectious pressure, on host resistance, cleaning floors, a post-milking tea disinfection, treatment of clinical and subclinical cases, etc. How about the attitude? What did people think of it? And I thought that a very challenging one, because as I just told you, I was one of those people that was in favor of blanket dry cow therapy for 20 years, and we changed that some 5-6 years ago. 80% of our farmers thought that reduction of antibiotic use was important. 75% of our dairy farmers thought that selective dry cow therapy was the right approach. And you've heard Christian Scherpenzeel presenting on that, our impression is that farmers were more adaptable to change than vets are. There we go. Put this all together in the R.E.S.E.T model. We're back to the beginning of my presentation. Rules and regulations. 70% decrease in antibiotic use. That was a clear message from our politics. Clear norms on the antibiotic number, ADDD. The SDA, or Veterinary Antibiotics Authority, or the Antibiotics Authority, they come up with the norms on level of action. Second point, education and information. I have to say that this is traditionally overestimated by veterinarians, also by myself, before I started doing this type of work. We always think that once we inform people, once they know, they will change their behavior, which is not true. Which is true for a group of them, but not for all of them. In this specific case, though, people were under-informed. Farmers told us, we didn't know. We didn't know about this high critically important antibiotics, that they might have an effect on resistance. So traditionally, they're overestimated. In this case, not. We did our research. Here you see them. Christian Scherpenzeel again and Inge Berends, Inge Sandman-Berends. They published their work in the Mirror of the Dairy Industry. And that helped us to convince those people that are internally motivated. And I showed you already about the critically important antibiotics, the effect on mindset of that. Social pressure, which is enormous effective. A couple of weeks ago I was in New Zealand, and when you talk about post-milking tea disinfection, people in New Zealand, they talk about spraying. Whereas when you are in the US, when you talk about post-milking tea disinfection, you talk about dipping. Why? Because everybody does it. That's what's called social pressure. And in New Zealand, they think that you're weird if you go to dipping, and if you're in the US, they think it's impossible. Why are people spraying? It doesn't work. Same cows, same iodine. That's what people think, social pressure. Extremely powerful. Changing society. I showed you this graph on the evolution of the dairy cow. And this also is something. If you're a vet, if you're a farmer, you come from a pig farm or from a field farm, and you go to the hospital and the red lights goes off. Something really has to change. That does have an effect on people. This is a nice story I like to tell, the ADD number. Kirsten just asked me, how does that work with that antibiotic number? What do people think of it? A year or two ago, I was at a conference, and there were two important dairy farmers in the country, these two. This man is called Piet Boer. He's the chairman of our biggest corporation, Friesland Campina. And this guy is called Schenk, Simeon Schenk, and he is the president of our farmers union. And Simeon, he was the moderator of the day, and the first speaker was Piet Boer on that farmers conference. And Simeon introduced himself. He said, I have 120 cows, my cell count is like 210, and my production is that and that, and my antibiotic number is 3.2. And then Piet came up and I said, okay, thank you, Simeon, thanks for this nice introduction. By the way, my antibiotic number is 2.8, am I better than you? So at that point, I realized that something had really changed. People know about antibiotic number, and they thought it important enough for these two people to talk about it in public. So at that point, I thought we really had made something in social pressure. Economic incentives. If you have to buy dry cow antibiotics, you have to pay them, whatever brand it is. And then tools to make it easy. We have the benchmark, we have the Veterinary Drug Authority, so people can compare. We have formularies, we have herd treatment plans implemented. We had a guideline. It was a year later than the introduction of the selective dry cow therapy, but we had it launched and people had a sort of a thing they could fall back on to introduce it. So putting this all together into that antibiotic usage model, you see that we have the rules and the regulations. You saw that we did our part on research and on information. The social pressure part really got to work at some point, economic impulses and also the tools. And that all together made that I think that our mindset on antibiotic usage really changed. We're not there, we have to continue, we have to see that the effect on animal health will be limited, but that's how we did it. And that made, and I told you that at the beginning of this talk that I would get back to this, that made that antibiotic usage really decreased, and we're leveling out now. 2015 is also there. I didn't put it in yet, but that's a little bit lower but at the same level. This is in Dutch. It's about this graph is on the total animal industry in our country. We don't have it in such a nice graph, but I had some data. This is in Dutch, but it says that in the dairy industry between 2009 and 2015, there was a 47% decrease in antibiotic usage within the dairy industry. Coming to my conclusions. Since 2007, antibiotic usage in the Netherlands decreased significantly. So far, we had that without dramatic changes in dairy health. Of course, there are individual herds where it goes to problems, where you cannot do without a blanket dry cow therapy. And yes, we are allowed to use it within a certain point of time, but people have to change their basic management in order to be able to cope with it. That's the approach. So it's not the solution through the antibiotics, it's a solution through the management. We did that through an intense cooperations with different stakeholders, and you see the logos of the different people, the different stakeholders involved down here, the dairy industry and the farmers associations, the veterinarians and the meat producing industry, etc. And to have a sort of a joint approach where we all sent the same message, in which we use the different points of that reset mindset model. And I'm convinced that really led to a fundamental change. Not sure whether it's as strong as the drinking and driving example that I showed you, but people talk different about antibiotics now than they did in the past. And with that, I'd like to thank you for your attention. I'm happy to take any questions. Thank you.
Okay, so just to say we have some speakers in the floor, and we've allowed some time for discussion and reflection on this, and because it's not often we get the chance to ask some questions on a very interesting issue that affects us all, that behaviour change concept. So any questions from the floor, please?
Peter Mansell from Australia. Thank you, Theo. A wonderful presentation. Could you, the graph that you had of the antibiotic usage, in the 3 or 4 years, 2004, 5, 6, the antibiotic usage goes up by something like 50% in that short period of time. How much of this was a reaction to a rapid increase in antibiotic use, and how much of it was building anyway?
You mean this one, Peter?
Yes.
Are you talking about these years here?
Yeah.
And your question is, how much was due to?
So you've got a rapid rise of increase of antibiotic usage in those years. How much of the regulation of antibiotic use was a reaction to that increase, and how much of it was happening anyway?
In a sense of political urgency, you mean? Yeah, well, that basically was what it was. I didn't put it in this time, but what we used to have is that you have growth promoters, use of antibiotics as growth promoters. That was forbidden, and it decreased from somewhere around the beginning of the millennium, and it was faded out until 2006, 2007. And as a reaction, that people used more antibiotics in general. So it was no longer in low how do you say that, low usage as growth promoters, but they used it through the feed anyway afterwards. So there was a sort of reaction, no preventive use anymore, but they still did it. And as a consequence of that, people saw that it was happening, and there were these incidents on R.E.S.E.T in pigs and in poultry, and then the whole political thing started. That was how it worked. Yeah.
Theo. Thanks for the nice presentation. It's always risky to ask a question when you're a presenter later on, but
sure is.
In the very beginning, you showed these graphs on antimicrobial resistance in E. coli, and you all blocked the data from 2009 onwards for some reason or the other. You showed it just to show that the situation, the dairy industry was not that bad as it was in poultry and in veal calves. What happened to these graphs? So if you now remove the blocks from the from the right side of the graphs.
Yeah. Where am I?
Because the reason actually why we do it is to reduce resistance. It's not something that we do for itself, let's say. Then it would be the residue issue, but we do it for the reduction of resistance. And if that isn't achieved, then it's nice doing it, but is it any progress?
Yeah. Good question. Thank you. First of underlying question is why did you block it? That's because it fits into the presentation. This is 2009, the time that we started the whole thing. And what I wanted to say here is that we had in dairy industry low antibiotic usage, much lower than in veal calves or in poultry. That's one thing, like 30 times lower. And we had lower antibiotic resistance. What we did do have, if you look at it in a bit more detail, is that it was increasing over those years. If you look at it from the perspective of the dairy industry. If you put this block away, then you will see that it will decrease a little bit. To make it not too complicated, I blocked it because there was a difference in, and you probably know that, Bernd, in sample collection, and I didn't want to go into detail on that. The basic of your question is more important, though. What happened to antibiotic resistance ever since this whole thing? And that's a hard thing to answer. This expert panel on our National Veterinary Drug Authority, they brought out a communique like half a year or a year ago on that it will be impossible to measure the effect of all these regulations on antimicrobial resistance. So what they said is we will not, politics at some point said let's try to see some effect, set some goal in antimicrobial resistance. And what they initially did is set a goal on decreasing antibiotic usage. Let's try to make the next step and set a goal in decreasing antimicrobial resistance. But the conclusion of that discussion was it's impossible to do that because it's much harder to directly influence that. Let's stick to antimicrobial use, set goals on that, and follow what's happening in antimicrobial resistance. And we do see some effects. But that's not the reason that I blocked it here, because it's public and you can find it, and everybody here can Google and find it. It's public information. But that's the tough part, which doesn't mean that we don't have to take precautive measures, of course. Yeah. Is that enough? Okay, my turn's next.
Theo, Gates Riddell from the U.S. I really appreciate your presentation. In the U.S., we've had some really good discussions between the veterinary community and the human community, such as the Center for Disease Control and Prevention. And we've focused a lot on antibiotic stewardship and metrics. In the Netherlands, is there any similar data on defined daily doses from the human side?
Yes, and there is in many countries. And in the end, I have to say that, of course, it's more important how much antibiotic is used in humans than in animals, talking about the effect of that on antibiotic resistance in humans. And as I said, I was in New Zealand a couple of weeks ago, and they have the fortunate situation that they have very little resistance problems in animals, and that they have very little antibiotic use in animals, but they do have a relatively high antibiotic use in humans. And that was the point in our country where, in a comparative scale between different countries, our country was doing very well in human antibiotic use, where we did very poor in animal antibiotic use. And you can have a lot of discussions, and we did quite a bit of research on ESBLs recently on the effect of ESBLs in animals, and we've seen the same in MRSAs, on the types of MRSA that you find in animals, and the hospital-associated types that you find in humans, etc. And that's not directly, of course there's a connection, but the use of antibiotics in humans is much more important, as it seems, than in animals. Which doesn't mean that we don't have to do anything. We still have to take a responsibility. There is an effect. And we do that also. We do that for humans, but we do that for our animals too, of course. And the other thing is that politics and the society at large think that we have to do it in a responsible way.
Have they documented a reduction in use on the human side?
Well, that differs from country to country. In our country, it's directly documented. We have a concept, and you probably know that, which is called One Health. And this report, the Maran report, is published once a year, and half of it is on humans and half of it is on animals. John.
Yeah, Theo, thank you very much for that. John Henry from Australia. I'm interested in what the milk processors were thinking around 2008, 2009 when the changes were coming through, because it seems to me that they could have swung either way. If antibiotics are being legislated to being reduced, they could see that as bolstering their ability to promote safe product. However, were they nervous about perceived changes in, for example, bulk milk cell count as a result of this? How much did the processors have to be dragged kicking and screaming to the table, and how much were they leading the charge, is the question.
Yeah. Well, there were discussions, and there were people that said, why didn't you bend over? Because what's the problem? And we have other things to think about. That's not what the dairy industry as a whole did. They took the responsibility, all those different stakeholders that I just showed you on one of my last slides. And yes, there were quite a few people that were worried about what the effect of that would be on other health. We just had this big national project, and we had been relatively successful on that. We made progress. And there were people that were really worried. Among them were practitioners. A lot of practitioners were worried about what will the effect of not using blanket dry cow therapy anymore be on animal health, and more specifically on other health. But at some point it was decided that, and there was one other thing, and that politics said, you have to do it. You have to organize it. And you can do it yourself. You have to pay it yourself. You can do it yourself. And if you don't, we will do it. But you still have to pay it, by the way. So all those things together brought that, and I recall very well, it was in December 2008. We were sitting in a conference room, and I'm not one of the stakeholders. I'm just an advisor with some other people. And they said, okay, we're going to do it. We're going to do this program, and we're going to go for it together. And that's what happened. Does it answer your question?
Yeah, I think so.
Okay, thanks, Jan.
Thank you for your presentation. In Italy, when we discuss about antibiotic resistance, usually we discuss between large animal practitioner and human vet and human doctors, and never talk about the pet vets. I think that one of the responsibility in antimicrobial resistance is due to the pet vet. And what is your impression? We have no data, and because we don't eat dogs and cats, that doesn't mean that the responsibility of antibiotic resistance is due to pet vets too. Thanks.
Yes, good question. Pets and horses. When I was asked to give this keynote presentation, I was specifically asked to talk about dairy cows, which is in my comfort zone, so that helps. But yes, there is a discussion there, and it's, of course, pet people having pets are not as organized as the dairy or the veal or the whatever industry. So it's much harder to get a finger on that. It's the other side is that it's not an industry, but they're coming up numbers now that Veterinary Drug Authority is working on it, trying to see how much antibiotics is used in general, and yes, there may be a big effect there. I'm not an expert on that. Maybe there are other people here that are, but the intensity that people live together with their pets is totally different than we do with our dairy cows most of the time. So yes, there may be an issue there. Andy.
Hi, Theo. Yes, thank you for the presentation. It's maybe a comfort zone for me as well, dairy cows and mastitis as well. And I was just wondering, the box ticking for selective is is a digital decision, if you like, but do you have any, and are you monitoring any percentages that that's happening? Because selective is a process, but are we looking at 10% having just not having antibiotic, or 50%? And are there any guidelines on that in Holland?
Yeah, we have a sort of we have a guideline introduced by our veterinary association on how to select cows, which is a responsibility of the sort of a joint responsibility of the dairy farmer and his advising veterinarian, and they have to make a program on that. If they have reasons to not follow that guideline talks about the somatic cell count at the last milk control date within 6 weeks before drying off. If you have reasons not to follow that because you think that if cows have had clinical mastitis, or if you do bacteriological culturing of cows, etc., you're allowed to not follow that guideline. But you have to make a decision on that at the herd level, which is a good thing, and which also is an opportunity for veterinarians to pick it up. I showed you that I looked it up over the weekend for this presentation. It was 28% in 2014, the first year that went down. I don't know exactly for the last years, but we saw a decrease in more or less that margin, somewhere between 30, 40, 50% of antibiotic usage for dry cow therapy. And the effect of that is that the antibiotic usage for clinical mastitis is going up, but only very slightly. And Christian Scherpers probably presented something on that the other day, but that effect is marginalized as compared to dry cow antibiotics.
Well, that would be exactly one small question. It's about the clinical mastitis, and how is it managed now without the critically important antibiotic, without C3, C4, and fluoroquinolone, the clinical acute mastitis in early lactation? How does the vet and farmer cope with that now?
Well, we still have a lot of antibiotics available which are not critically important, first and second preference, as we call them, antibiotics, penicillin and others. And if you have good reason, based on sensitivity patterns, to use them, you can still use them, but in practice that's hardly ever done. I showed you the numbers. It's really down very much. What's coming up what we're working on in our country, as many people are in different parts of Europe and the world, is to try to come to on-farm tests, to have on-farm culturing or other on-farm tests where you can decide on an individual cow, an individual case, whether or not to treat that with antibiotics, and preferably also on sensitivity patterns on what type of antibiotics. That's a whole different discussion. My colleague Annette Veldhuis presented a bit on that last Monday morning, I think. But that's one of the approaches to solve that problem. In general, of course, there will be individual farmers or individual vets that say it is a huge problem, but the majority of our farmers and vets don't think so.
Okay, we have time for one more question.
Thank you very much for Ireland. I'm very interested in the animal-defined daily dose. How is that presented to? Is it at farm level? It's presented, or does a farmer receive a report, a monthly report or a yearly report? And what records are made to get that? And who issues the defined daily dose?
Yeah, thank you. How it's defined, how it's calculated, that's done by the Veterinary Drug Authority, which is an independent organization. And there's a whole discussion about it. As I told you, I was in New Zealand a couple of weeks ago. There they have a more or less comparable system, but there what we calculated was dry cow therapy as 4 treatment days, whereas in New Zealand they do 1 cow 4 quarters as 1 day. So there are different systems, different countries have different systems, and I would like to advocate to make that one system worldwide. That's not what it is today, but that would be one thing. The stakeholders decided that it would be good to have an independent authority to decide on that, so that we don't have discussions on whether it should be 1 day or 4 days or maybe even 35 days because a cow is protected for 5 weeks or whatever. So that's done independently. We have that number. What the dairy organizations did was that they built up a system where the antibiotic use, or I should say the antibiotic amount that is delivered from a vet to a farmer is registered. And that's, the farmers have to do it because the farmers' organizations can only make rules for the farmers, not for the vets. So it's an obligation that the farmer has, but the farmer says to his vet, you have to do it for me. I'm your client, you have to deliver those data to the national system. That system is called Medi-Rund, that's like medicine cattle, something like that in English. And a farmer gets a report every three months. And there's an ADD number, the antibiotic number as they call it, and how that exactly calculated is into the bylaws and everybody can look it up. But there will be only a few of those internally motivated people that will go into detail and see how that's calculated, and sometimes you have discussion about it, but in general people don't care. It's a number, and they know that 2 is low and that 6 is high. Okay. So they have it every 3 months, and then it's defined on oral use, on intra-mammary use, on dry cow, on intrauterine use, on parenteral use. So we have a lot of numbers. It's also specified for different types of antibiotics, and they have all that information. And it's a wonderful source of information also for vets to pick up and work with it with their clients.
Okay, I think huge interest in this talk, fantastic presentation, and fantastic interest from the audience. So can you put your hands together and thank Theo for an excellent talk?
Thank you. Thank you.